So talking about Tommy John injuries, and it's reached an epidemic proportion in the major leagues. So if it's reached an epidemic proportion in the major leagues, we can only assume that at the lower levels, at minor league baseball levels, at the community level, there's got to be a problem going on. So the question becomes, how do we stop it? How do we adjust for it? What do we do to make a difference in the community and to make a difference in our young athletes coming up? So I've talked to Dr. James Lebolt. He's a sports orthopedic surgeon for the Spectrum Health Medical Group, and he was also trained by one of the preeminent surgeons who does this surgery, Dr. James Andrews, who is one of the individuals that many of the Major League Baseball players seek out. So we're going to listen to Dr. Lebolt talk a little bit about what he tells patients in an office visit, and then we'll regroup at a later date and we'll talk about what he said and maybe provide some additional explanation.
So the Tommy John injury is a ligament on the inside of the elbow. It's traditionally an injury to the ulnar collateral ligament, which is the primary stabilizing ligament to the elbow in a thrower's motion. So what does that mean? There's a ligament like a rubber band on the inside of the elbow. When you're throwing, and particularly repetitive throwing, it can get stretched, can get damaged if you're throwing too much or overuse injuries. But that inside ligament actually stretches out on the inside, and with that it actually pulls away from the bone. So the traditional Tommy John injury we talk about, it was named for Tommy John, who was a pitcher that had this surgery done. He was the first one to have it done, so they coined the surgery after him. But basically we take a ligament from the wrist in most cases, and some people don't have that ligament. Occasionally we have to take that from the knee. But we take a ligament from the wrist and we actually weave it around the inside of the elbow to help support the native ligament that's supposed to be there supporting the elbow through the thrower's motion.